Thank you very much for joining our seventh Health Security Dialogue hosted by Global Health Innovation Policy Program. My name is Hiromi Murakami of GHIPP, Global Health Innovation Policy Program, facilitating this dialogue series. We're very honored to welcome distinguished guest today from Taiwan, Dr. Brian Chang. Japan lifted the second emergency still cautiously watching if COVID-19 would revive or not. On the other hand, Taiwan has managed the COVID-19 relatively well, and it's under control. So we very much would like to hear how Dr. Chang observes the situation and beyond what we're experiencing today. So the purpose of this dialogue series is to build a community for sharing knowledge and experience and discuss how to best prepare for the future health crisis and build health resilience. We're very excited to hear from Dr. Chan, as Taiwan is one of the most successful countries to continue making COVID-19 under control. We'll have Q&A session in the remaining time. And for administrative announcement, please submit your questions on the Q&A column on the bottom of your screen, so that we can address your questions appropriately when we have a Q&A session. Let me introduce today's speaker, Dr. Brian Chan. Dr. Brian Chan is a family physician and specialized in community health, health policy, and health promotion, and the end-of-the-life care. He serves as the Secretary General of Taiwan Medical Association since 2020, and Honorary Secretary of World Organization of Family Doctors, Asia Pacific region since 2016. He has been engaging in international health affairs for a long time and playing an important role in international non-government organizations. We'll have Dr. Kiyoshi Kurokawa of GRIPS will join later, and he will be commentating. And he's a professor emeritus directing GHIPP, and he has also long been involved in global health arena. And he's a member of World Dementia Council, International Scientific Advisory Committee, and many other institutions. With that, I'd like to pass microphone to Dr. Chan, and we greatly appreciate it that you're taking time for us and sharing your view with us. Thank you very much.
Thank you very much, Dr. Murakami. Kind introduction, and ladies and gentlemen on the internet, I'm Dr. Brian Chen, and I'm very happy to have this chance to be invited by the GHIPP to join this dialogue. And besides me is the president of Taiwan Medical Association, Professor Cho Taiyuan. May I have some time to introduce him, because he's a very, very important leader of the medical association, and also he's a legislator in Taiwan. So many of the health policy in Taiwan to contain the COVID-19 is an important leader, and also lead all the physicians, whether it's in the hospital or the communities, to help Taiwan to show our achievements to contain of the COVID-19. And I really want to take a little bit time to thank you, Professor Cho. Thank you. And before this dialogue, I will really introduce what I'm going to say today. My presentation will become two parts. One part is we'll talk about the national policy. That means we'll a little bit time talking about the government, the Department of Health, the policy from Department of Health. So it's the view from the public sector to let all the participants of these meetings to know what the Taiwan's government is guidance about preventing the COVID-19. And the second part, I will, of course, talk a little more about the role of Taiwan Medical Association, because the Medical Association is the NGO and it's a private sector. So you will see how the public sector can cooperate well with the private sectors to help Taiwan to contain the COVID-19. So I'm gonna show the PowerPoint, please. Okay, this is how Taiwan has been done so far in the COVID-19 pandemic control. We do not have lockdown, and from the April 12th, 2020 to December 21st, we have no local infections for 253 days until we open the border control for some foreigners to come in. Foreigners or some of the Taiwanese people will come back for the Chinese New Year. So we have the single community, single infected patients to come into Taiwan. But we still, until now, we still do not have the community transmission. And the face mask from was mandatory for the public transportation, indoor public places, and outdoor large assemblies. And most of the Taiwan people are willing to wear masks whenever they go because they have this experience from the past SARS experience. I will talk about it a little bit later. And until now, Taiwan only has 1,009 cases. Among these, we have only 10 deaths. And we reported 185,439 people and tested 471,988. So we quarantined 17,701 people and home isolated for 582,503 people. So you can see that we have, as compared to other places from the world, we have only around 1,000 cases of confirmed infection, and among them only 10 deaths. So I think it's a very good experience for me to show you. But how can we go this far? Many of the Taiwan's doctors, they think that we learned a lot from the 2003 SARS pandemic. Please, next slide. This was as you can recall, okay, next one. As you can recall, this happened 17 years ago, and at that time we have hospital lockdown for 150 unprepared infections and caused 35 deaths in one hospital. Next slide. It is okay, and this is the TV news for reporting the first death of the head nurse in this hospital. It's the Heping Hospital in Taiwan. But at the very beginning, the situation is not so bad like that. It started from the SARS outbreak in South China, but from February to the early of the April, actually we successfully has 0 cases and 0 deaths in the community until, next slide, until we have nosocomial infection in the Heping Hospital. So how did it go to this way? We have a discussion during this time that it is maybe because we have overconfidence, because the first beginning 2 months we have 0 cases, we have 0 deaths. We think we have built a successful role model. So we have the loophole in the border control. We do not monitoring community pandemic. We do not report the community infection, and we do not well prepare the hospitals. Next slide, please. So this is what we learned. This is the ultimate pandemic statement. We at last during the SARS, we have 346 confirmed cases and 73 deaths, including 11 healthcare professionals. And this is not what we expected at the very beginning. So what do we learn from this SARS? We find that we have to continue the supply of the face mask. As I can recall, when at the time of the 2003, I was a community hospital in the medical community health center, and I can recall that when the outbreak of the community infections, we cannot find the proper protective gowns, so we have to wear the raincoat for the community trace of the patients and the delivery of the food to the isolation patients. So this is a very well learned experience that we have to prepare the PPEs for the future coming the new infection or pandemic. And how do we manage the home isolation and also the capacity of health facilities? And we have faced the inquiries from the public or the medias that we have different resources of the information. People cannot tell which one is the truth information, which one is the false information. So these are the very important lessons we learned from SARS, and we make this change and reform so we can deal with this time the COVID-19. Next slide. So I will give a brief summary about what we learned from the SARS. It is the strong consensus in government and society that pandemic prevention system in Taiwan has to be reformed. With one, we need a rapid pandemic monitoring and advance alert. Second, we need a powerful, exclusive central command system. This I will answer because Dr. Murakami has sent me some Q&As from the participants on floor. They are asking about how CDC can deal with the different departments among the government. That because the lesson we learned from the SARS is that we need a powerful, exclusive central command center. So when this pandemic occurred in Taiwan, we set up this central command center, and it's led by the director of the Department of Health and Welfare. So it can control. Actually, I was not sure if I use this word right. It can control, it can command the different parts, department of the government, only focusing on the COVID-19 containment. So this is a very important the reform, as I can share with the physicians in Japan. And the third one is we need the healthcare network, especially in the community. And we need to protect the hospital from nosocomial infection. And the fourth is that we need a daily public communication, so the people and the residents will know what the government is trying to do, and so the objections will go. We will not have so much objections from the public. Next slide. And next slide, please. And this is what I told about the prepare of the hospitals. During this COVID-19 period, we have regional contingency hospital. We have 6 designated regional contingency hospitals, and totally we have 102 negative pressure isolation wards. So if we find severe infected patients, we have place to we have the good settings for them. Next slide. And this is the very first alarm when we received from the Taiwan's biggest internet BBS PPT. We have been alerted that we might have the mutant of SARS, something like SARS virus from China. And next slide. From the first 3 days is very important, because the first case appears in Taiwan is in the January 21st, and the government was very fast decision that we stopped the flights and travels from Wuhan. And later on, we have we see the Wuhan lockdown. So the decision is very important because it has a very quickly border control. And then we set up these, we call the COVID-19 command center. And with the setup of the command center, they give the daily briefing, the daily press conference to the public. And not only to deliver the health policies the government wants to do, but also they take questions from the media, from the journalists, so they will know how these health policies could influence the daily life of our public. And they might try to overcome this discomfort, or they might a little bit adjustment about a change of their policies, so the people in Taiwan can are willing to follow the instructions of the command center. And I think this is a very important first steps, so Taiwan can control the COVID-19 pandemic so well. And next slide, please. And the next things is that we need, and the next thing we need to deal is the shortage of face masks. So the government takes the responsibilities. Their production lines increases, and it was controlled by the government. So the price of the face mask can be controlled in a level that the public can accept. And government will release the stocks, because I have told you before that we learned from the SARS, whether the CDCs or the hospitals, they have stocks of these face masks or the protective gowns, and the government will see the difference between the regional supply to call the balance and the release for the PPEs they need. And the other things is that most of you might know that Taiwan has the national health insurance card that is digitalized, not only the medical records, and during the time of COVID-19, we can also input the travel history, travel data, so we can know. So with the collaboration of CDCs and the Ministry of Foreign Affairs, we can know that any suspected patients, when he visits the clinic, the places he has traveled, either from at the very beginning, especially from Wuhan, from China, and if the patient have this fever or other suspected severe respiratory symptoms, we might think them as the very highly infectious patients. So we can, with the bigger protective ways to avoid the transmission to the community people, we can test it. We can have tests of these patients and treat them without the further community infection. Okay, next slide. And this is the home quarantine management. Everyone who will come back to Taiwan from other countries has to file a personal health records to show where you have been. Do you have any symptoms or signs? Is likely to have the airway infections. And you need to have 14-day quarantine, whether it's in the quarantine hotel or it's the home-based isolation. But you need to, and if you leave the place you were quarantined, the GPS system, you have to put on your cell phone on this questionnaire when you import Taiwan. And if you leave the place you quarantine, the GPS will notify the police station. So the policeman will go to find you wherever you are. And this is a very strong policy that the people are not going to walk around and to transmit people in the community. So I think this is very important. The digital management. Next slide. And with the time going, from the very beginning, we have 6 designated contingency hospitals. We expanded the capacity of the our healthcare systems to 22 contingency hospitals, and we totally have from the beginning of only 100 negative pressure wards to the later on the nearly more than 1,000 negative pressure isolate wards. But it is because of the first management, the very beginning, the first policy is correct. So to avoid a massive transmission in the communities, so we can preserve the capacity of the healthcare system. Next. And all of these was rely on the diverse triage. We have 3 levels of triage. The first level is the public health triage. That is the triage of the people suspected of exposure. We need the 14-day home isolation. We need to test if they have test the PCRs if they have been infected of COVID-19. And we have the second level is the outpatient or ER triage, and it is the I just mentioned the NHI, the National Health Insurance card was connected to the arrival system of the customs, so we can trace back the travel histories. And with suspected cases, we have this triage. We quarantine them and we tested their PCRs. And there are the level 3 are the inpatient triage. With those suspected or confirmed cases transferred from the communities, we give them a higher standard of the patient care with the doctor-patient 1 to 10, the ratio 1 to 10, and we give the allowance for the health personnel to taking care of the patients. So we want to make sure they are well treated, and until the PCR became negative and the symptoms recovered, we discharge these patients to the communities, so they will not cause the further transmission in the community. So through this triage, whether it's from the custom, from the clinics, the outpatient clinics, or from the hospitals, we can push we can make sure that the preserve of the health system. Okay, next. And this just show the daily press conference. Within the center is the commander, is the director of the DHO, the Department of Health, and the person next to him is the convener of expert team, and consists of, he's the leader of a team, consists of the infection specialists. So trying to make sure all the health policies, not only the government wanted, but also can also with the evidence from with the medical evidence that these are the best policy to deal with the containment of COVID-19. And because of these daily press conference, all the people from Taiwan can see those government officials and the specialists and the physicians on the television explaining to them about the policies and reporting about the current status. So everyone can be, I think they can be more confident on the government policies and are willing to obey. Next. So I'll give a brief summary about the things I just mentioned before. We see from the government's point of view that Taiwan's experience and efforts to contain COVID-19 are including the pandemic monitoring, the quarantine border control, and reserve of the PPEs, and trying to get the healthcare system ready, and prepare of the laboratory diagnosis and testing, and also the daily press conference to communicate with the public. And okay, the next slide. And later on, I want to talk about the role from the Taiwan medical associations, and I'll give you a brief briefing about the TMA. TMA consists of the 24个，对不对？24. The Taiwan Medical Association is the central medical associations. The concept is the central medical associations, and it has 24 regional medical associations. Each one represented a city or a county in Taiwan, and the Taiwan Medical Associations consists of all the nearly 50,000 physicians in Taiwan. And so the Taiwan Medical, the TMA, not only to trying to cooperate with all the things I just mentioned before, the government policies, but because of its private rule, it can do things more, because it can show more warmth. It can know people more because they are closer to the public. Because the people in the people always trust their doctors. So as a private role, we can deliver a more to the heart words, so the patient can are more willing to follow the policies with the government. Next slide. And except what I just mentioned, the SARS, it is a very important model I have to talk to you, is that after the 1999 big earthquake in Taiwan, as you can see in the pictures, you can see the large buildings breakdowns, and the 2003 SARS attack in Taiwan. Next slide, please. We have this model called the community healthcare groups. It is a very innovative model at that time, a little bit like the group practice, but not all about that. It consists of the 5 to 10 GPs, and one of them are specialized in family medicines, and they recruit the patients from the encounters in the communities. But they do more than the group practice, like you are well known in UK or other places. They do not only treat the diseases, they also do things of the continuous and comprehensive care, such as we have 24-hour consultations. So, and we have health promotion, we have disease prevention, we have chronic disease management, like we will call you to see do you have any adverse events after you taking the pills, reminding you to come back to the clinic to see your doctor, reminding you to do the pap smear, to do the vaccinations. And also these community healthcare groups, we call it CHCGs, they have regular meetings and share experience with their backup hospitals. So during these models, it is very important that the physicians in the communities, they not only treat the disease, they do the case management, they do public health, they have I would say mutual referral and cooperation with the hospitals. And these are very important backbones when we're talking about the community network in dealing with the COVID-19 in Taiwan. Next slide. So with the post-SARS experience, I will show you that in the community, the CHCGs, they include the preventive medicine and pandemic control informations, and they have continuous medical education on infection control. It's very important because all of these CHCG stuff are required to have at least level of infection education certification, so they can renew their the doctor's certificate. So everyone in the community hospitals, the same as the doctors in the hospitals, and those are the doctors in the community, the same as the doctors in the hospitals, they all require the infection, the new information and new knowledge about the information. So that makes us can have quick access to face this COVID-19, this new pathogen into the communities. And with their past experience, they will set up the fever screen spots because of the SARS. So I can remind, because I'm also a family physician in the community, so I can remind that at the very first appear of the COVID-19, we do not have a basic knowledge of this virus, but we can sure about one thing, that if any patient was checked, the temperature is higher than 38 degrees, we will bring him to a separate places, so we can avoid the transmission and the infection and transmission among the patients in the community. This is a very important idea. I will show you later how this makes great achievement in Taiwan's containment. And we can, and we prepare the PPEs. We have smooth process from the referral between the clinics and hospitals, as I just mentioned, because they have monthly, they have meetings together. So the referral pathways are very smooth. And they also train the PGYs for the community health. And those PGYs are going to become the very important physicians in the COVID-19 session. Next. And then these are the roles as the national medical associations. We prepare before the pandemic to assist the national health authorities in a continuous monitoring of pandemic information of case reporting conditions. Next slide. When the pandemic appears and spreading, these are the things we need to do to assist the national health authorities to distribute PPEs in feasible and effective ways, to strengthen the public outreach of clinical monitoring in each communities, to timely release the accurate pandemic information, and to strengthen the international communications, sharing experience of pandemic preventions, and promote the exchange of PPEs. And these are the important guidelines leading by our president, Professor Chiu Tai-yuan, is the summary of how Taiwan's dealing with this COVID-19. And we think these are the very important roles of national medical associations. And I will take this chance to share with you. Next slide. And it's very important that we have communications. The government communicate with the public, and the TMS communicate with all the doctors and the regional medical associations. So we have, at the very beginning, we have weekly contingency meetings. As you can see, on the left and the right of the slides, all the regional leaders of the medical associations are online, discussing with the President Chiu, talking about, at first, we talk about how to distribute the face masks, and is there need to supply more of the PPEs, and how do we come up with the standard operation procedures? Because at the very beginning, the government only give the SOPs of the hospitals, but with the leading of Professor Chiu of all of these contingency meetings, we gather the wisdoms and from the regional leaders, we came up with the evidence-based SOPs. So all the physicians in the clinic, they have a SOP to follow. Before we have the government guidelines, we can know how to deal with the suspected patients. Next slide. And these are the pictures we're showing about the communications. We set up these goals to protect the public and medical staff. We call it the Safe for Taiwan and Care for People. And we established the joint discussion and invited the infection experts to join the meetings to share what the knowledge we know, whether it's of the COVID-19 or it's of the COVID-19 vaccines. So all the all the physicians of the medical association, all the physician doctors can have the acknowledge of these new pathogens and the new treatment and the new prevention method. And so they can deliver the correct knowledge to their patients. Next. And we also invited those who have been infected and recovered from the care of the doctors to share their experience being a patient and share how they've been treated with all these kind doctors in Taiwan. So through these communications, we build a very strong trust between the physicians and the patients during COVID-19 period. Next. So these are, we think, the successful prevention of COVID-19 is we have the strong community healthcare groups, and the primary care network respond quickly to the pandemic. And we have this tiered pandemic prevention model to maintain the healthcare capacities. Next. These are the evidence of showing how important the community first-line prevention is important. These are the very first months cases we get from the NHI, the National Health Insurance data. Next slide. From the first months of these COVID-19 from Wuhan, you can see we separate the patients, whether they go to the medical centers, regional hospitals, district hospitals, or clinics. We can see that more than 3/4, more than 75% of the people going to the clinics, going to the private care settings for the treatment. And because of the primary care network, all the physicians are well acknowledged. They have the previous SARS experience, as I explained before. They might have these SOPs recommended from the TMA, the meetings, so they can set a very good front line. They protect and prevent the community transmission, so we can preserve the healthcare capacity of the hospitals to preserve for these severe infected patients. Next, and these are the tiered preventive models. We have published in the famous academic journals, the GHIPP Open, and I will not spend much time talking about this, and you can find it in the internet. But next slide. The idea is that I'll give you only a simple idea. The simple idea is that, next slide, is that we next slide, we keep the less symptom or not severe symptoms patients in the clinic, and we reinforce. That is the level 1 clinic, and the level 2 is we reinforce some of the specialties such as ENTs, family physicians, or pediatrics. They might encounter more acute severe patients with well-equipped protective equipment, so they can treat more severe patients. And with suspected patients, refer them to the community screening station. If it's negative, we keep them treating in the level 2 or level 3. And with a positive, we transfer them to the tier 4, the level 4, the medical centers or designated hospitals. So with the separation of the severity of the patients, we can keep the capacity of the healthcare systems, because we not only need to deal with the COVID-19, we also need to treat the chronic patients, the daily patient we need to face. Okay. Next slide. So these are the tier medical care's retains healthcare capacities. With this, we share the burdens on hospitals in fighting against the outbreak, when at the same time, we can retain the medical care capacity to care for patients with acute or chronic conditions on a daily basis. And this is the only way for a strong system to fight against a new virus for a long time. Next slide. And these I will show you are the actual pictures we take from the clinic physicians. With suspected patients, they wear the face mask, the helmet, and the protective guns, still treating the patient. Okay, next slide. And the next slides are those I want to share you how the TMAs have international sharing on the COVID-19 control. Because of the time, I will go through this quickly. The first is the interview from the WMA Secretary General of the Dr. Otmar Kloiber in March 26th. These 3 points are his comments of Taiwan's prevention of COVID-19. He says the government of Taiwan respects professionalism in the fight against an epidemic and advanced preparedness of Taiwan Medical Associations. Second, Taiwan's national health insurance makes medical care highly accessible by its people, and they are fully confident with medical care providers. Third, the strong primary healthcare system in Taiwan helps diverge some of the community capacity to keep COVID-19 under control and share the strength and healthcare capacity of hospitals in preventing against the pandemic. I think these are very important key points in our prevention. And next slide are these Taiwan sharing our experience in Shima meeting. Next slide. We also share with the Australian Federal Ministry of Health. Next slide. We share with Professor Yoshiharu Tokuda from Okinawa. Next slide. We share with the British Medical Association. Next slide. And we also share this year in January 8th with the Japan Society of Crisis Management Medicine. And these are the last slides. These are the officers of the TMAs. They are not from the government. They are all volunteer doctors who work. Our Deputy Secretary General. They are willingly, and also our board of directors of TMAs, they are willingly to go to the media, go to the TV, to have health promotion to the public and policy advocacy. I will show this because this is very important, because the government's delivering of the policy, health policy, is very rigid and cold. And with those physicians, the community doctors, they go to the TVs, they use the language that the people are well acknowledged. They maybe they say some jokes, funny things. It's like a talk shows. So especially I want to introduce our Deputy Secretary General, the Dr. Low from the right lower bottom. He nearly goes to the TV shows every day. He always have new innovative concepts, and he will use the words that people are well known, not the cold and unidentified medical terms. He is a psychiatric physician, and he know how to treat not only the physical, but only treat the mentally. So watching his talk, it's just like watching the talk shows. It's funny, and you can get knowledge. So through these work of the officers of the TMAs, we give very strong powers for the public to support, not against the government's right health policy, but also through the media, we can also recommend the slight adjustment of the government's health policies so it can fit the average people, the people's needs, or to make the frontline doctors more easy to practice. Okay, next slide. 2 days before, the March 22 is a very important day because it's the first day Taiwan's giving the shots, the AV COVID-19 vaccine to the doctors. And I really hope that through the injection of the vaccines, we can ease the pandemic. We can hope that the transform of the virus was not so fast, that the human immunity can overcome these threats from the COVID-19, and everyone can travel around the world as before and see each other face to face and shake hands and hug. This is my delivery. Thank you.
Thank you very much, Dr. Chang. Thank you, thank you. It was very, very detailed and a very informative presentation. And we now, I think, understood why Taiwan's approach was so effective, including those, the trust you built among patients and doctors, and then also community-based, massive organization, and then also, coordination with the government, and also the very strong initiative of TMA, which I think is different from a little bit different from Japanese case. So we have some of the questions we have. Then maybe I can start just one, and then I will read from the question that we already got. The one is that, we understand that you learned so much from SARS.
Yes.
And, with this COVID-19, very successful management of COVID-19. So what do you think that will make more resilient, with this kind of pandemic in the future? Are you more confident? I mean, I'm sure you're more confident, but do you think, is there anything you could be doing more for the future pandemics?
I think from the TMA point of view, I think it's that the government should have more, transparent and free discussion with the medical associations, because the physicians from the associations are more close to the public in the communities. They will know more what they will face, the challenge they will face in the front line. Although the government is already being asked our recommendations about the policies, but I hope we can do more, like when they are talking about the important policies, it's important to invite the officers of the TMAs to join. Yes.
Great. So I will pick up the question from the audience now.
Oh, sorry, I cannot hear you.
Okay. It's sleepily. As you mentioned, that Taiwan has healthcare network at community level where they contribute to the containment of COVID-19. Could you please elaborate more on the role of healthcare network in containing the COVID-19? How does the healthcare network function? To what extent the network can contribute to the COVID-19 containment in Taiwan?
Okay, I'll give you a example. Like a patient coming to a clinic, they will show us the national health insurance cards. When we put in the cards, we can know if he has travel history to other countries, or has he ever been visited other medical facilities. And that is very important, because if he already going to see 2 or 3 doctors, we will know that, oh, the symptoms must be last for a long time. And the other things that we educate the doctors to pursue the TOCC, the travel, the occupation, the TOCC histories. So it will help us to decide if it's a suspected patients. Because if there's a clusters infections, whether it's among the workplace or whether it's among the families, then we'll know he might have more possibility, the risk to have the COVID-19 infections. But once we suspected about the COVID-19 infections, we will have a telephone number we can call in Taiwan it's the 1922. So they will have protected, they will have transportation to protect the suspected patients go through the laboratory place to check the PCRs. And of course, I hope that in the future we'll have the fast screen, so we can check only the salivas or something, so we can do in the clinic settings. And once we make sure if it's infection or not infections, we can through the mutual transmit. We already have the backup hospitals, as I mentioned before. So the pathways of transfer to hospitals is very smooth. So I think that is a very that is how we do in containing of the COVID-19 in the community. I hope it answers your question.
Thank you very much. I have one more question. You laid out many, the measures and the system. And do you think that the measures that Taiwan utilized could be exercised in Japan or other countries? Do you think other countries also can use this Taiwan model to deal with this COVID-19? Or is it because of Taiwan very special about Taiwan or do you think it can be applied to other countries?
I think most of them can be applied, such as the border control and the group practice and the daily doctors go to the media to have health promotion to the patient, to the public, and also the trace and the quarantine, but only the national health insurance, because we already digitalize, only this part can should need sometimes. But I think with the 5Gs, we cannot, even without the health insurance cards, we can use cell phones to do many things. It only takes time to invent some of the apps. So I don't think we cannot replicate those models. But there's one thing very important, because I want to say that this successful containment in Taiwan is vital to the health education of the public. I think Taiwan's people have very well knowledge of how they can protect themselves from being infected. They know they always wear them face masks. They always wash their hands, not only with waters but with the alcohols, and they are willing to follow the right health policies from the government. And they don't spread rumors. They will tell each other that, oh, you do not watch this information, this is wrong, and this one is the correct information. With the public health, a good public health literacy, I think this is also a very important part, how we can make these achievements.
Thank you. And is Dr. Kurokawa there? Dr. Kurokawa?
Oh, yeah. Thank you very much for the session. And I think we really enjoyed this kind of dialogue. And Taiwan really excelled in this emergency unexpected things. And one is better communication and also the leadership and sending us a very good message to start. That is very important. And one example is also like this become pandemic. And I think that how the head of this nation conveys a message to the people is a very important element. Taiwan is small, but for example, like Germany, Chancellor Merkel really made a very nice speech to the people. So that kind of message at the top, unexpected emergency, is a very important element to capture the trust of the people. So I think that we could learn. I mean, not everybody can do that, but we have to learn. And so that is the issue. Unless you learn from a failure, or just not necessarily a failure, but unless you capture the better practice so the hyper-connected world, you are just losing the thing. So that is a lesson. Thank you. Great.
Thank you.
Thank you very much. We have very, very informative and very comprehensive presentation. Thank you, Dr. Chan, and also thank you, Dr. Tso. And thank you very much for your time. And I think all the audience really enjoyed your presentation.
Thank you. Thank you very much.
Thank you very much.
Right.
Appreciate it.
Translate.
Thank you.
Thank you. Bye-bye.
Well, bye-bye.
Okay.
Thank you. Thank you very much.